Okay. All right. Well, welcome everyone to the Center for Transformative Nursing and Health Research at, Wednesdays at noon is what we call this session. I'm Dr. Megan Aston, the director of the center, and co-chairing with Julie Berry, our research manager. So I do want to acknowledge that we are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kma'ki people, and that we're all treaty people of a treaty of peace and friendship. So welcome to everyone, and also to acknowledge our African Nova Scotian ancestors who have been here for 400 years, more than 400 years, and also our Mi'kma'ki people for 11,000 years. So it's great to be here. Very cold day, but virtually we can connect from all over the world. So welcome to everyone and thank you for coming. So today we have two sessions and three presenters. So our first is Maddie Gallant, who is a PhD in nursing candidate. And our other two presenters are doctors Mari Somerville and Brittany Barber. So I'm going to turn it over to you, Maddie, and you've already got your slides up. Okay,
Perfect.
over to you. And
Yes.
just under 30 minutes to present with questions. Thanks.
Sounds great. Thanks, Megan. Everyone can see my slides okay, hopefully. Okay, great. So thank you everyone for having me here today. As Megan mentioned, my name is Maddie Gallant and I'm a PhD candidate at Dalhousie University. I'm really excited today to be sharing with you all about our environmental scan that we completed just over, I guess, it's almost been a year and a half, but our findings and our next steps for our project. And I also have listed here our co-authors on the bottom. So Megan did a beautiful acknowledgement, and I'd also like to acknowledge that Dalhousie University sits on Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. We are all treaty people, and also acknowledge the histories, contributions, and legacies of the African Nova Scotian people and communities who have been here for over 400 years. So I've put a picture of the beautiful Annapolis Valley, which is also situated in Mi'kma'ki, and that's where I'm talking to you from today. I've also tried to really incorporate more of an active acknowledgement within my presentations. And given that it's Black History Month, I wanted to share just a webinar series that's offered through the National Collaborating Center of Determinants of Health. It's a really great webinar series that really prompts a lot of critical reflection, and I know has changed some of the ways that I practice in my clinical practice, as well as I move forward in my research. So I have the link just on the slides here that you can click if that's something that you're interested in. The webinar series is from last year, but it is, I think, still very relevant to today. So today I'll be talking a little bit about our environmental scan and also the next steps for our project. I'll give a background and significance of why we're doing what we're doing, what methods we used for our environmental scan, and then also sharing our results from the environmental scan and how that's contributing to us moving through to our phase 2, which is co-design. So integrated knowledge translation has been defined by Kothari and colleagues in 2017 as a model of collaborative research where researchers work with knowledge users, such as patients, families, clinicians, decision makers who identify a problem and have the authority to implement research and recommendations. So IKT really aims to bridge that gap between evidence and practice. So as you saw in the animation, we have one side of the bridge, which could be our evidence, and then the other side of the bridge, which is practice. And we still today see this continued lag between translating that knowledge into practice. And so IKT really acts as that bridge, or this pink piece within the bridge, to bridge the two together so that we have a research that's really timely, is moving into practice to make effective change. IKT has shown a lot of different benefits for research. It's shown to improve the quality of research. It's shown to enhance the value. It's also shown to create really meaningful engagement with key knowledge users who are affected by the research that we're doing. And it also helps to create a direct impact. So because of how foundationally integrated knowledge translation is situated on collaborative research practices, it really helps to enable our collaboration and meaningful engagement of those who are going to be impacted by the research that we do, both indirectly and directly as well. And the reason why this happens, or that foundational reason, is that we really, our IKT really helps us to partner with our patients or families or knowledge users and address a priority in research, or address a priority that's been identified within the population that we then can, as researchers, can address through research methods. Throughout the entire process of IKT, key knowledge users are foundationally important to all of those different aspects of the research process, which then again helps to have these benefits, such as that improved research quality and really just the responsiveness of our research findings to the needs within our population. So despite this importance of engaging in an IKT approach to research, there still continues to be this parallel, or this gap that's found between the healthcare system and research practice. And so they're still completed in parallel. However, on the other side, there's also this increasing expectation as graduate students that we engage in an IKT approach in order to ensure that our research creates impact and has that meaningful contribution to the populations that we are studying. So our team completed a scoping review in, I believe it's 2021, where we looked at trainees and using an IKT approach to research. And within the scoping review, we found that trainees were very motivated to engage in an IKT approach. They saw the benefit, but there were a variety of different barriers that were identified as creating challenges for trainees to engage in this particular approach. One really important one being that there was a lack of education, and the second one is that there was a lack of guidance on how do you actually move through this process of engaging in IKT as a graduate trainee. And so those findings from the scoping review really prompted this second project, which was to find out, are there any guides that exist across Canada in supporting trainees to engage in a IKT approach to their research? And then also, if there is any, can we co-design a specific guide that's reflective of specific barriers and facilitators that are found for trainees within graduate research? And so we conducted an environmental scan. And if anyone has conducted an environmental scan, it was kind of a gray process. There's not a ton of literature that's out there on the methods used to complete an environmental scan. And so we really hoped and really meticulously documented how we completed an environmental scan to really contribute to that body of knowledge. And what we did is we used Godden's gray literature search methodology as our foundation for our environmental scan, and then kind of grew from there. And so step one was for us to identify a research question, which our question was to just simply look out and see what guidelines or guides exist for graduate students to use an integrated knowledge translation approach to their research. Step two was for us to identify different relevant sources. Step three, we actually developed a three-staged search strategy. The first stage that we did was we looked at Google, the Google search engine, and we had a set number of terms that we used. The second stage, we actually went to all graduate programs across Canada, universities that offered these graduate programs, and searched within their university websites specific terms that we used as well for Google. And then finally, our third one was to actually consult with experts via email to determine if there were any guidelines that were available to their knowledge within their university community. So we tried to speak with administration within the graduate program of a specific university, or any associate director that might be able to point us in the right direction. Step four was for us to extract the data, and then step five, we actually analyzed the data. And for our data analysis, we used a directed content analysis approach. We used the International Association for Public Participation tool to really understand what level of participation was used within the guides. And then we also used a engagement in research process categories just to see when the guides that we were hopefully going to find recommended actually engaging in the research process. And this QR code right here, that just takes you right to our publication for the environmental scan. And that project was funded by the Nursing Research Development Fund through Dalhousie University. So if you wanted to take a closer read to what I'm talking about today. So when we did the environmental scan, we scanned a total of 22,900 results. And when we went through all of those results, we found 183 relevant for detailed screening. And then from those 183, we only had 3 documents meet our inclusion and exclusion criteria. And though initially discouraged by the outcome, it actually really pointed to that overarching problem of the fact that there aren't any guides that are available across Canada to support trainees and graduate health programs to engage in an IKT approach. And although we only found 3 documents, we did learn some important insights from those documents. Some things such as the importance of early engagement, how they rated the participation based on that IAP2 tool, and then also about really establishing a detailed integrated knowledge translation plan alongside of a research plan. So those were some common findings that we found in all 3 of these resources. Although these resources had identified that research trainees could use them, they weren't specific to research trainees. So we continue to see this gap in actually having a guide that was specific to trainees and reflective of their specific barriers and facilitators that they might encounter. So because we had only had 3 results, we decided to take a step back and do a post hoc analysis of the 183, so I'll go back a slide, but these 183 documents that were relevant for detailed screening. And so when we looked at those 183 documents, we really noted an important culture shift that was happening. And we did a conventional content analysis of these results and grouped the results into 5 different categories. So the first category was that there were many strategic plans that we found and annual research reports that really emphasize the goal of using a collaborative research approach within their university communities. We also found that grant funding applications and resources that were available to support graduate trainees were starting to require certain considerations using an IKT approach for their applications for grant funding. We also found many courses, events, education sessions that were kind of one-off opportunities for graduate students to learn more about IKT. We also found some information education materials that really emphasize this importance of using an IKT approach and why we needed to engage in this for our research. And then finally, we did find some toolkits and some guides, but they were very specific to researchers rather than graduate student trainees. And we realized that although these toolkits would be really important and maybe supportive of early career researchers, they still weren't reflective of the unique considerations as a graduate trainee and those barriers that we as graduate trainees may face during our graduate studies and actually engage in an IKT approach. So as I mentioned before, some of those key findings that we found was that the first, we really need to have this engagement with key knowledge users from the very beginning of our project. The second thing that we found from the environmental scan was that separate plan and the need to really have this intentional attention to how we're going to engage in an IKT approach throughout the entire duration of the research process. And then also what we found when we did our post hoc analysis overall was that there was this important culture shift. So really supporting that use of IKT, there were more funding opportunities, and then also this kind of surge of education opportunities like seminars and events that could support that translation of the importance of what IKT is. So after all of that, we realized that there still were not any guides that were available to support graduate student trainees, and really specifically a guide of how to. So those tangible steps that could be enacted in order to successfully engage in an IKT approach. And so that really fueled that second part of our project, which was actually going through this co-design session. And so initially, we had planned to do it more at a local level within Dalhousie University, but we've actually partnered with IKTRN, so the Integrated Knowledge Translation Research Network, and we're going to be doing it on more of a national level, looking at trainees' experiences in engaging in an IKT approach, but then also using that knowledge to then co-design a guide that can be used across the nation to support engagement in an IKT approach for graduate trainees. And so at the top, I've listed our objectives of our phase 2 co-designing. And we're building off that scoping review initially that I talked about and the environmental scan findings. And the purpose of phase 2 is really going to be to explore the experiences of trainees in using an IKT approach. And we're also going to be exploring academic supervisors as well as knowledge users, as they are a key part of the team in engaging in this IKT approach. And then what we will be doing is we'll be using those findings of those experiences to then inform actually designing a guide that will be used across the nation. And so we're going to be using qualitative description design with multiple qualitative methods in order to address our research objectives. And we're going to be using the generative co-design framework for healthcare innovation to guide our co-design process. And so it's within this framework, we have a pre-design, a co-design, and a post-design phase. So as I mentioned, that pre-design phase, this is where we're going to be doing that qualitative descriptive study, learning about the IKT experiences and different barriers and facilitators that trainees in health research have faced. And then we're going to move on to the co-design session, which is where we'll actually hold a virtual co-design workshop. We'll refine the content and format in order to create an IKT guide. And then, finally, the post-design will be where the research team will meet, will review those co-design findings and actually develop something that is going to be supportive across the nation to support graduate students to engage in an IKT approach to their research, really offering that tangible how-to to engage successfully and hopefully to ultimately improve the responsiveness of research across the nation. So thank you so much for listening to my presentation. This is my email at the bottom. If you're interested in anything that I talked about today, or you have any questions at all, please feel free to reach out. And then finally, I just had an abbreviated reference list of some of the different references that I used in today's presentation. Thanks so much.
Thank you so much, Maddie. Fabulous information. So I'm going to turn it over to the audience to see what comments, questions you have.
Good. Thanks, Megan.
Yeah, I'll just monitor the chat, or if you want to put up your hands or just open your mics and ask a question. That's the clapping hands.
Yes, thank you.
Just give people a moment to. Paulina, go ahead.
Hello, thank you for the presentation. Well, I'm Paulina, and I'm in the first year of my PhD, and in my research, I want to use IQT. But I don't know if you can see some challenges that I could have, considering that the population that I'm working with are children from 4 to 6 grade, because I want to know from their perspective what are the mental health interventions that they think that they will be meaningful for them to promote their mental health.
Sounds like a very timely project, Paulina. And I think I'm too kind of starting to learn, what challenges you might face and depending on different populations. And from what I've learned so far in engaging in IKT approach and from the literature is that it really having an intentional dialogue with who's going to be affected by the research. So including children and in that sense also their parents or their primary caregivers, and learning from them how best to involve them within research. What does that look like? How can you best support them? And then creating that tangible plan so that you have those levels of accountability, that you're able to follow that throughout your entire research process so that you have that perspective. My research is with adults, so I haven't had the experience, and I'm not sure if my supervisor might be able to speak to that, Christine, about engaging children in an IKT approach. I haven't come across that, but it's definitely an important topic, and that would be my recommendation, would be to have that open dialogue in order to decide how best you could include them.
Thank you.
Thank you.
You're
Great
welcome.
question, Paulina, and thanks, Maddie. Yeah, other people, we still have a bit of time for questions and comments. Stick Lab, I'm not sure. Yeah, go ahead.
Hi, it's Leah asking the question. I wondered if you'd ever considered looking into courses. So you say you're looking for guides, like standalone guides, but I also wonder, like, how many KT courses are being offered to graduate level students? Is it something you ever thought about looking into, or is that just too big?
No, that's a really great question. I think like in our environmental scan, that was something that we saw a lot of, was these like one-offs or one-time like opportunities that were available. And I think just like I think it would be interesting to see what's offered and have that, you know, consolidated and provided for trainees to, you know, engage in if they wished. I think our hope was that sometimes, and I think a lot of people that are on here that are graduate students can, you know, time is very precious within grad school. And so to add another course, you know, you may not necessarily have the time to do that full course. Our hope is by having this guide that will have a step-by-step process where you can engage and then further engage in, you know, maybe education specific to different areas that you may not be comfortable with or need more information on. But I definitely think it would be an area that you could look at. And from our environmental scan, we definitely saw that there was a proliferation in the last couple of years of courses, but just not something that we truly focused on. Thanks, Leah.
Thanks.
I had a quick question, if I can interject, and just your presentation just shows us the rigor of really understanding integrated knowledge translation. And there's so many words that have been out there over the years. So I'm just learning more about this now. So, you know, knowledge translation, and wondering if there's any connections with, say, participatory action research or patient-oriented research. I know those are very broad, and sometimes they're methodologies and theories and things like that, but there's just so much out there. But so it's really nice to see, you know, a very specific, rigorous way to understand knowledge translation and all those other terms. I didn't know if you had any comments about the language and if there's even any connections with, or how those connections might be.
Yeah, definitely. I spent a lot of time the last little bit on learning about, because the population that I'll be doing my PhD with has a history of marginalization and stigma. That was one thing that I really wanted to make sure that I had a collaborative research approach to how I was conducting my research. And IKT is kind of under that umbrella of collaborative research approaches. And there's been a lot of discussions in the literature about, you know, how does that compare to participatory action research or patient-oriented research and kind of, you know, all those other research approaches that are there. And from what I've learned so far and learning about these different approaches is that it really depends on your research question. It depends on the motivation and the purpose of collaboration for your research. And so for my specific research, I'm looking at an implementation process and really looking at, you know, how do we best translate a model into care. And so for me, IKT was the best way to engage collaboratively with my population, but because it gave me those specific I guess, methods and tools in order to address those research objectives that would be important to my specific study, such as, you know, engagement with key decision makers, really identify, like throughout the entire research process, having advisory from different knowledge users. And so it's definitely kind of on that under that umbrella of collaborative research approaches. And from my experience so far, I felt that it's really dependent on, you know, that motivation or the goal of collaboration and what you'd like to get out of it, on which approach you would use.
Thank you. That's really helpful. Does
Yeah.
anyone else have a comment or question?
I think
Oh, I see a hand in Stick Lab. Go ahead.
Yeah, it's Christine. Great job, Maddie. Your presentation really highlighted the rigor that you took through this environmental scan. I know that there was a lot of steps and a lot of records that you reviewed. So you did a really nice job synthesizing those. Just in your last 1 minute, I wonder if you want to do a little plug for recruitment that's coming up.
Yeah, I was wondering about
Yeah, so yeah, definitely. So we will have our kind of pre-design session that's coming up, and what we'll be doing is a series of focus groups looking at the experiences for health trainees. So if you are a graduate trainee in health and you're the first one, do we need to, is the inclusion that they have had to have used an IQT approach or just planning to use it, Christine?
I think we'll have to double check, but I think it's that they have used it.
Yes, so have used it. That's what I thought. I didn't want to misspeak. But yes, that you have used that specific approach. We'd love to hear from you. We have some great gift cards for your involvement as well, but also that you can really help in this process of designing something that can be used across the nation. Is it only for grad students or ECR? I just see a question. So we're focusing on
postdocs are included.
Yes, yeah, postdocs are included as well. And we're looking for trainees in health research is our plan. So yeah, any interest at all, please feel free to email me and I will get back to you on our information.
Thanks, Maddie.
Wonderful. Thank you so much. Okay, now we're going to turn it over to our next presenters. Mari, would you like to begin and share your screen? I'll turn it over to you. And we don't hear any sound yet.
Thanks. I think Brittany's gonna share, but I'll just mute myself. Thank you very
Yeah, I know you're just getting organized. We don't hear anything yet, so we will let you get started again. That's okay.
Can you let me know if you hear it this time?
We can hear you now, yes. Oh, but when you start it, I'll let you know.
Postdoctoral fellow and a health system impact fellow at IWK Health and Dalhousie University. Today, I'll be talking about learning health systems and in particular, talking about the implementation of learning health systems and share some of the recent research that we've been doing on this topic. I'll provide an overview of learning health systems and then talk about some of the gaps in research, and I'll share a recent systematic review that we conducted and then finish with next steps. So the definition of a learning health system was initially coined in 2007 by the Institute of Medicine. They describe a learning health system as a system where science, informatics, incentives, and culture are aligned for continuous improvement and innovation, with best practices seamlessly embedded in the delivery process with new knowledge captured as a byproduct. A bit more recently, the Agency for Healthcare Research and Quality, they defined a learning health system as a system where internal data and experience are systematically integrated with external evidence, and that knowledge is put into practice. As a result, patients get higher quality, safer, more efficient care, and healthcare delivery organizations become better places to work. And so in this definition from 2012, they share some similarities with the Institute of Medicine's definition. They talk about data and that continuous improvement and learning brought into practice, but the Agency for Healthcare Research and Quality also talk about the patient and the healthcare provider as being really important in that learning health system definition. Learning health systems can be implemented at different parts of our health system, different levels of the health system. So they can be in individual organizations or even departments within an organization. So for example, the Learn from Every Patient is a learning health system that is in a specific pediatric population within a hospital. There's the Evidence Now, which is a learning health system, and that was implemented across the primary care system. So in the United States, there's also provincial-wide learning health systems. So in British Columbia, they're working towards a provincial learning health system. And then a learning health system could also be at the national level. So the Swiss learning health system is an example of a learning health system that's at the national level. And so this model can be implemented in various settings within our healthcare system. There has been several reviews or evidence synthesis conducted to identify some of the key components in a learning health system. So a really good paper was conducted by Zarinsky and others, and they looked at over 200 different learning health system studies, and they really brought that evidence together in this white paper on the left here, and they identified some of those key characteristics or components in a learning health system. They also talk about key learning health system frameworks and models in that paper. There's also been some work done here in Canada. So this middle rapid synthesis paper was a piece of work that was done by a Canadian group, so John Lavis and others, and they also identified some of those key aspects to a learning health system, and they were looking specifically at a Canadian healthcare context. And then on the right, Matthew Minier and colleagues, they conducted a review to identify a framework for creating learning health systems. And so from this work, there's been several models and frameworks that have been developed to describe what a learning health system should include. So on the left, the bottom left here, this was a framework that came out of that paper by Minier and colleagues, and they identify specific learning health system outcomes, processes, and pillars that are key to include within a learning health system, and specifically to create value-based healthcare. The one in the top middle here, this was a learning health system framework from the Learning Healthcare Project in the UK, and they describe learning health systems in this kind of circular continuous learning framework, and then they also identify important components to include in a learning health system and look at different layers or levels of the healthcare system in their framework as well. The one on the bottom right here, this was a more recent framework, and this was developed by Trillium Health in Ontario, and they describe a learning health system as being part of, or they relate it to an engine where you have certain fuel or accelerators that are required to include in a learning health system, and then they have the center engine or cogs here that are key aspects to a learning health system. And in their framework, they specifically talk about equity, which is kind of unique to their framework. And then on the far right here, this is from the Agency for Healthcare Research and Quality, and they have kind of a more simplistic diagram depicting a learning health system. And again, they also use that cyclical continuous learning type framework, but they identify patients and providers as being central to that learning health system framework. There's also been several key constructs identified as important within a learning health system. So these are 5 constructs that Friedman and others have identified. And similarly, John Lavis and others, they identified 7 key constructs as being part of a learning health system. And there's been others out there as well. And there are a lot of similarities across the literature when it comes to what a learning health system should include. So again, often they talk about having data, having this continuous learning cycle, having patients as a key part of a learning health system. And so from all of this evidence, we have a good understanding of what learning health systems are, or at least what they should be, and what kind of key components they should include. However, we don't have as good of an understanding of how we actually bring this idea of learning health systems into practice. So this was the research gap that we were attempting to address in our study. So to address this gap, we conducted a mixed method systematic review where we looked at the implementation strategies and outcome measures for advancing this learning health system concept. So we used the PICO format to conduct this review and identify articles to be included. So we looked at learning health systems. So that could be any learning health system terminology. So rapid learning system, learning healthcare system, learning health network. Our phenomenon of interest was implementation and or outcome data. So the study had to be talking about how they implemented a learning health system. And we were interested in any healthcare setting. So as long as there was care being delivered to patients, the study was eligible for inclusion. We looked at qualitative, quantitative, mixed methods, and gray literature sources. So after running our search, we identified just over 5,000 studies that met our search strategy criteria. And of those, we included 35 papers, which represented 31 different learning health systems. And these ranged in terms of the type of system and the population. So some studies looked at older adults, some were on pediatrics, others were looking at a general population. And then studies varied in terms of that healthcare setting. So some looked at an individual unit, some were organization or hospital-wide. Other learning health systems were a network of learning health systems across multiple institutions. The majority of studies were conducted in the United States, and they were all fairly recent. So majority were conducted since 2019, so in the past 4 to 5 years. And several studies reported on positive outcomes, such as reduced length of stay or improved time to diagnosis. We categorized the studies based on the learning health system characteristics that they reported, and we found that digital data capture was reported most often, whereas patient engagement and culture of rapid learning and improvement were reported least often across studies. And one of the studies reported on only 2 of the 7 characteristics. And we used John Lavis's 7 characteristics to code the data across studies. And these are just some examples in this table of how we coded some of that in the paper. So for example, patient engagement was coded in a paper by Perito and others, as they talked about including the patient and family voice in their learning health system. We also coded the implementation strategies that were reported across studies, and we did that using the ERIC taxonomy. So across the 35 studies in our review, we had identified 33 different implementation strategies used across studies. And change record systems was the most commonly reported strategy, and we had found that all studies reported on multiple implementation strategies. And again, in this table, you can just see some examples of how we coded those strategies in the studies. We then triangulated the data, so we had qualitative and quantitative studies in our review. So we identified common themes across both types of studies, and we came up with 3 integrated findings. So the first is the digital infrastructure of learning health systems optimizes health service delivery. The second key finding was that learning health systems have a positive impact on patient care and health outcomes. And the third is that learning health systems can influence healthcare providers and the health system. And so these are the kind of common themes that we had identified across all types of studies. So some of the key takeaways from this review is that there are gaps in some of the characteristics that are included in the learning health systems that were reported or that we included in our study. And either there's gaps in the actual characteristics of those learning health systems, or there's gaps in how they reported those. And those gaps are around patient engagement and culture and competency. So these characteristics weren't really identified as often as some of the other characteristics in our studies. And then our review also provides a good starting point for researchers. So we've identified some of those most common implementation strategies that were used across studies in their implementation of a learning health system. So other researchers may be able to use this to start figuring out how they can implement their own learning health system. And then the results also show a positive impact on patient outcomes. So studies that did report on outcomes typically reported on patient outcomes. However, there wasn't as many outcomes related to the cost, population health, providers, or equity. So there's definitely a need to conduct further evaluation of learning health systems to see that broader impact on the quintuple aim. So the next steps from this work are to then implement a learning health system here in Nova Scotia. So as part of my role at the IWK as a postdoc, we intend to implement a learning health system, starting with specific departments or units within the hospital, and then eventually scale up so that the entire health system can one day become a learning health system. And so one example is to look at the patient safety program, which is at the IWK. So it's a program that's underway. There's lots of work being done related to patient safety. There's some safety coaches, patient safety consultants. So there's a bit of that culture already there related to patient safety. There's an online digital reporting tool, so the incident reporting system that's being used. And there's already some processes in place when it comes to patient safety events. But what we'd like to do is to compare this patient safety program to a learning health system to see how well it aligns with that model, and then work towards adapting it or evolving the patient safety program to be a learning health system. And so that's some of the future work that's being done here in Nova Scotia at the IWK. Thank you, and happy to, if you wanted to reach out via email or to answer any questions.
Thank you so much, Brittany and Mari. So I will turn this over to the audience to see if there are any comments or questions. Yes. I love all the interactive diagrams and just, yeah, so many, well, circles and moving parts, but it just shows the complexity of the way people are thinking about this in so many different ways.
Yeah,
There, oh, I see you there, Brittany. There we go.
Yeah, sorry, just because we're short on time, my presentation flows really nicely with Mari, so it might be best to just keep going and then we can.
Sorry about that. Yes, I
okay.
wasn't. No, you still got 15 minutes. Go for it.
Okay. So can
Thank
you see still my screen?
Yes, you can see your screen and also the slides on the left-hand side.
Yeah, it should be coming. Here we go.
Perfect.
So yeah, my work builds on what Mari just presented on learning health systems, and I'm going to be talking about the environmental sustainability piece of that. And I'm sorry, but I'm going to, for some reason, this image can't be displayed, but oh no, are all of them? Just give me 1 second here. I'm going to pull up a different presentation.
Yeah, sure. No worries. I know we can see them all on the left-hand column, but
yeah, they don't seem to be loading.
Yeah, that's okay.
Just give me 1 second here.
Yep, no worries.
Okay, here we go. So we have already mentioned that we're in unceded territory of Mi'kma'ki, but we need to think, what does this actually mean in the context of the research that we're doing? And although we have the privilege of living, working, and playing here, a lot of the values from Indigenous culture relates to environmental sustainability, and they are stewards of this land. So I think putting that into context of my research is really important. And I don't need to convince you that climate change is one of the biggest threats we face, but you might be less familiar with the contribution that health systems make to greenhouse gas emissions. And if all health sectors were a country, they would be the 5th largest emitter globally. And in the context of Canada, we are amongst the top 3 worst emitters per capita in the world. So we have a lot of work to do. And so you might be thinking, okay, what does this actually mean? There are direct and indirect sources of emissions. The first being the facilities themselves. So hospitals were never built to be sustainable, and our aging infrastructure, we need a lot of energy in these buildings, and depending on where you are, the grid to supply that energy is not always sustainable. Nova Scotia has a particularly dirty grid versus BC, which uses a lot of renewable energy. And then the hospitals themselves, they are massive users of energy. So all of the services that they provide, they're always operating, and that causes indirect emissions. And lastly, healthcare is primarily designed to be a very linear system. So a lot of consumables and a lot of waste is generated from this. Just to put things into perspective, this is the waste that was created from one 10-hour procedure. So this is an artist from the Netherlands that took all of the waste from her breast reconstruction surgery, and she has displayed it, and she does this for a lot of different procedures. And her art asked a question: is there another way? And so I don't want to leave you with this bleak image, and there's been a lot of work that's started, and particularly in the UK with the NHS. So they've transformed their systems into more net zero. And you can think about different approaches we could use: LED lighting, active transportation, reducing our waste, telehealth services. Procurement's one of the biggest areas. So can we look at supplies and materials that are low carbon, even prescribing? And then moving upstream, can we look at preventing disease and reducing our demand on health services in general? And this all contributes to the triple bottom line, which is to improve patient care, reduce costs, and then mitigate our environmental impact. And so that really complicated figure, it just demonstrates the complexity of this problem. And we really do need a systems approach in order to coordinate climate resilient, low carbon healthcare. And after hearing from Mari, all the different models, learning health systems, they're defined as systems that seek to continuously generate and apply evidence. They actually provide a great framework that we could look at using in order to coordinate environmentally sustainable health systems. But looking at a few different models, environmental sustainability is not integrated within them. And so part of my research is understanding how learning health system frameworks can strengthen the organizational approaches to environmental sustainability. And so this particular project looks at what are some of the challenges to advancing environmentally sustainable learning health systems, and then what do people recommend to strengthen our approach. And so I conducted an environmental scan, and prior to this work, there was a local literature review done. So a lot of scanning on different internal documents as well as external. And so understanding what work has been done in this area to develop an organizational strategy, and there's not a lot that exists. And so we went on to talk to internal health system leaders and healthcare professionals, as well as external knowledge experts on the topic. And so this work was really guided by LAVIS framework for learning health systems, which you can see is synthesized to the side there with 4 different categories and 7 characteristics. And so I used a deductive content analysis approach. And so after talking with 18 health system leaders, they identified 7 key challenges and recommendations that all fit within the themes. And so the first one was really the patient engagement piece, and we know that patients aren't really engaged in the process yet. It's still pretty early, and we don't even use a planetary health framework within patient-centered approaches to care. So a recommendation is that patients are really part of the process so they can co-create strategies because they're impacted by climate change as well. And so organizational goals should be framed around that. The next challenge was the environmental impacts from different sources are not really measured and monitored across health organizations. And so in order to do that, we need partnerships to improve timely sharing of best available evidence and make sure that we're measuring sustainability metrics consistently across organizations. The next challenge was that with healthcare in general, things are often siloed to clinical units, and that's the same for a lot of this work. And so we really need embedded project teams to be able to support the timely production of research. Organizations are also challenged to support the gathering and sharing of data. And so we do need a centralized data management system that can inform what the environmental impacts are from delivery of care of different units. And then aligned governance. So there's not a lot of policies and procedures influencing the day-to-day behaviors within an organization so that they're aligned with environmental sustainability principles. And so we do need to work towards having embedded research scientists within procurement and infection prevention, different parts of the health system in order to support this decision-making process. And then there's also challenges in shifting the culture towards sustainability. And so we really do need people, champions throughout the organization that can steward low carbon healthcare, and they need to be at all different levels. And lastly, the competencies piece. So we know that there's not a lot of knowledge and awareness about the impact of different healthcare practices. And so we do need some sort of training and resources across organizations so that people are at the same level and that they can be aware. And so the discussion, learning health systems frameworks, they do provide like a systems approach to understanding what organizations really need to do to coordinate their efforts. Learning health systems also discuss a lot about value-based healthcare, but what does this actually mean? Because it largely ignores the environmental and social value and costs from the provision of healthcare. So how can we operationalize value-based healthcare without the environmental lens? And then lastly, we do need additional research to explore how change can be coordinated and implemented within health centers to advance environmentally sustainable healthcare. So I'm happy to take any questions and feel free to reach out. I know we're short of time.
That's okay. We have a few minutes and we did start late, so I would just like to suggest that we go a little bit over time. So we'd love to hear questions, comments from the audience. This is just amazing work. Thank you so much, Brittany and Mari. Systems is such a large area, but you've really, for me anyways, you've really been able to make a really clear argument and very exciting. So turning it over to our audience, any questions or comments for Brittany or Mari? Give everyone a moment just to think about it. Are the two of you working together, Brittany and Mari?
So we're both health system impact fellows and we're in the same lab. Some of our work has been more recently overlapping, but yeah.
Yeah, and how did you come to do environmental stuff, Brittany?
It was something that I took a course during my PhD, and I have a background in health geography and health systems, and have had a lot of experience working in different health systems. And so it was something that I kind of took on as part of the learning health systems. Just noticed there was a gap in the approach, and it's a priority for IWK, so it just seems to really fit together.
Yeah, no, I love hearing the path that researchers take. And so all those pieces really came together for you. And oh, Mari and your son, hello. So Mari, what else would you like to share with us, if anything, about, sorry, the learning health environments, etc.?
Thanks. Yeah, I don't know. I don't know if I have any additional things to share. I know the kind of next steps that I talked about, that was originally kind of the direction of my work, but as Brittany and I were both talking about, it is hard to change health systems. So that's kind of like our plan, but I'm not sure, I guess, timelines, how that'll play out, but that's in the works at the moment. But yeah, we're but Britt and I both finished our fellowship in August, so that's our long-term plan. Sorry, I'm kind of distracted.
No, thank you. You're just totally multitasking, but that's really, really helpful.
What I said made sense.
Yeah, no, but it just brings up all of the ideas about the complexities of the systems, and many of us just become paralyzed. Like, I think the system, how do we do this? But you're offering all sorts of, well, frameworks, theories, methodologies as researchers, like how do we do this? And then your recommendations. So that was really clear, Brittany. And yeah, both your presentations went together so well. Just how do we do rigorous research and make a difference? So just brilliant work. And yeah, anyone else from the audience? Let's give ourselves another minute or two if you have any questions or comments.
Feel free to reach out. We're happy to I know we're running short of time, so thanks so much for joining us.
Yes, thank you to everyone today, and just action-packed. And again, this is recorded if everyone wants to look at it again, and we know where to reach you. So thank you so much, Brittany, Mari, and Maddie.
Thank you.
Great. Have a nice day, everyone.
Bye.